Hello. In this EPIC training module, we're going to talk about how to set up your initial care plan and how to document in them. Now, what's important about the care plan is that this is where your goals are going to be located. Now, with care plans in this facility, all the other disciplines, nursing, case management, as well as physical therapy, occupational therapy, and speech therapy, document in the care plans. Now, when you set up your care plan initially on your initial eval, there are 4 things you want to keep in mind when you set up the goal itself, set up the goal. The first item is template, next is problem, goal is third, and then lastly, intervention. Now, because the other disciplines document in the care plan, what template does is it tells EPIC which discipline you are. In our case, it will either be physical therapy, occupational therapy, or speech therapy. So when you set up the care plan for the first time, you're going to select the Apply Template button. And from there, you're going to type in the discipline that you're logged into. And in this case, we're logged in as a physical therapist, so we're going to type in PT. Now, in the production environment, there should only be one physical therapy item, so we're going to select physical therapy in this case. Once you do that, you're going to get a pre-made list of goals that you can select from. Now, the goals are pretty expansive, so kind of use your judgment as far as how many goals you want to pick whenever you document. Going back to those 4 items we were talking about, template, you can see is physical therapy in this case. The problem, and if you notice in the list here, the problems are in bold. In this case, there's impaired aerobic capacity. And within each impairment, there are a list of goals, both long-term and short-term goals, and interventions to correspond to those goals. So as an example, we're going to pick 2 goals and document on them, and or at least set them up and then document on them. Now, you notice the little icons that are next to each of the individual items here. If you mouse over them, it will give you a short preview of what the goal says. And as you notice that there are a bunch of asterisks and codes in some of these, and those need to be edited out. So 2 simple goals that we can pick from, we'll scroll down. We're going to find impaired bed mobility. And we usually pick short-term goals because, for one, they're editable. The long-term goals tend to be pretty generic. As you can see, they'll say, will be independent by discharge. So we're going to pick a short-term goal and an intervention. In this case, for bed mobility, we'll pick therapeutic activity. Again, the 4 items, physical therapy is our template, our problem, impaired mobility, our goal, and then our intervention. So I'm going to scroll down a little bit further and find a gait goal. We'll select this short-term goal for ambulation on even surfaces, and the intervention, gait training. So once we're done selecting the goals that we need, we're going to hit accept. And you notice from this screen we can see the goal, the template, and intervention, and the problem. Those 4 items. Okay. Now, if you read the goal, like I said, there are a bunch of codes in them, and we need to edit those out to make them appropriate to the patient. Now, to edit the goals, you can either click on the hyperlink here, or you can actually click from the outline menu here on the goal itself. And you get to a point where you see 2 buttons, Edit and Document. So since we're doing the initial setup, we're going to click on Edit. And one of the first things you can do, you can set your time frame for however long you want this goal to be. You can click on the little calendar button and actually pick a date, or you can actually use little shortcut keys, in this case W+1 for 1 week, or W+2 for 2 weeks. Same thing that applies if you want to do by months. m+1 for 1 month or m+2 for 2 months from now. Now if you look at the goals, you notice that there's 3 asterisks at the beginning and all these codes that are in them. If we try hitting accept now, it's not going to accept it because they need to be edited out. Now you notice that there's these 2 yellow arrows on either side over here. If you click on one in succession, it will highlight the different aspects of the goal that need to be edited out. So the 3 asterisks at the beginning are just a marker, so you can actually delete those. Click on the arrows, and from the menu itself you can just go through them and just select the appropriate value or thing that you want to use to item that you want to select from that menu. So in this case we're going to pick bilateral. Again, we'll go through the menu itself. It's pretty in supervision, min assist. Now you will notice that with some of the goals, as you read them, the context, some of the menus may be redundant. If that's the case, you can actually hit delete and edit the goal so it's kind of grammatically correct. Now once you're satisfied with the changes of the goal itself, you can hit accept and it will accept it in the system. So we're going to do the same thing with the other goal. Edit. We're going to set our time frame for 2 weeks from now, so W+2. And we'll use the arrow keys to edit the goal out. So I'm going to delete the asterisks. Now you will notice that you should read through the context of the goal itself because not all the things need to be deleted. So the asterisks in this case will denote how many feet we want the patient to walk. So we'll say 100 feet. And we're going to talk about with an assisted device, we can select rolling walker. And notice to select the item, I'm just double clicking the item in the menu itself. So level of assistance, supervision. And if we want to do any queuing, we'll say min queues. Again, I'm going to double click. And once I'm satisfied with the goal, we're going to hit accept. And that is how you set up your initial goals at the initial eval. Same thing will apply as if you want to add new goals to the system. Again, you would click on apply and go through that list again itself. Now, as far as on your succeeding visits with the patient, when you need to document on the person's progress toward the goals, you would highlight the goal, click on the document button, and within the document button there is a pull-down menu that you can select the outcomes for the goal. Usually they'll either be ongoing if they haven't been met, or if they've actually met the goal, we're going to say met. In this case, we're going to say that the goal is still ongoing. Okay. So from there you can, once you select the ongoing, you're going to hit accept summary, and then you can move on to the next goal and document on that as well. So the goal is ongoing, and hit accept. Now you will notice that when you do document or label the goal as ongoing, the ongoing mark shows up above the goal itself. Now if you do want to get a little bit more specific about documenting on the patient's progress toward goals, you can hit document, label them as ongoing. Within this text field you can actually explain a little bit more about the patient's progress toward goals. So we did mention that the patient's supervision, you can type in items as such as patient ambulating 50 feet with min assist. So if you happen to type anything within this field, if you hit accept, it will actually take you to a different section of the Note Navigator. And it also gives you an option of being able to comment again on your comment on the goal. The important thing to note here is that this time here, you want to change the time to correspond to the time of the rest of your note in the Navigator. Earlier we had typed in 11 o'clock, so I'm going to say 11 o'clock and then hit File. So in a sense, when you document on the goal that way, you're actually making a care plan note, which will actually also show up in the notes section of the Navigator, of the Epic system. Hopefully this information was helpful as far as setting up the care plans and documenting on them afterwards. Again, if you have any questions, please ask.